Hello, I'd like to report about the LiMAx test and the scientific data behind it. Actually, the LiMAx test has been developed by the Charité and the Free University of Berlin. And it's a pretty easy test where you inject 13C marked metastatin into the blood of the patient while the patient is laying in bed and is wearing a breathing mask. And as soon as the metastatin then enters the bloodstream and the liver, it is metabolized in the hepatocytes, in the CYP1A2, to 13C marked CO2 and paracetamol, in a sub-therapeutic doses. And so the 13C marked CO2 is exhaled into a machine where with a infrared laser technology, the amount of 13CO2 is measured in comparison to the 12CO2, and this reflects the current liver function. So after a time period of 15 to 60 minutes, depending on the quality of the organ, you have your LiMAx value, and from there you can use this LiMAx value then to make medical decisions. So I have put together some of the rich data that have already been evaluated with the LiMAx test, and just shortly read you through this. So it comes from the liver surgery, and the idea was to develop a methodology to make liver resections more safe by predicting the liver function after the operation. So this here is the approval study done by Charité, mainly by Professor Stockmann. And there 150 patients were measured, or were included into the study. And in the end, what was the outcome? Patients that were measured with LiMAx prior to the operation and the day after the operation had shorter ICU days, because many of them above a threshold of 150 microgram LiMAx, they could directly go to the normal ward, and there was no necessity to put them to the ICU. So they had a shorter ICU stay, they had a shorter hospital stay, and on top of this, they had a very, very low level of severe complications. So the severe complication rate was also very low. So then there were also studies done in liver transplantations. Just one example here, in a study with 99 patients. The idea was to find out if LiMAx could help to detect early graft failure, and this came out very clearly that in the end only LiMAx was a single independent predictor of organ failure. So therefore you can use LiMAx after transplantation to see if the organ works or if the patient needs to be put on a retransplant list. So after that, there were studies done then in other interventional indications such as TIPS, TACE, and meanwhile also radioembolization, and just showing you here two examples. So TIPS, the LiMAx done before and after TIPS showed that there are cutoff values again, that in a patient that has a cutoff of 205 before and 165 after TIPS, if patients are above these values, they are show a very good. They have a very good prognosis, and if patients are below these cutoff values, they have a higher risk for an acute liver failure in the time after the TIPS procedure. Regarding TACE, also shown here, that's one study that has been done at the University of Mainz in Germany in 25 patients, and also here the conclusion is that the LiMAx test can help to decide if a patient should undergo another TACE, because it is a very good predictor in short-term mortality in patients that already have a bad liver function in cirrhosis and have probably undergone more than one TACE interventions beforehand. So then in differential diagnostics, there was a study done by the University of Essen. Professor Görken and Dr. Büchter did this, and they did a combination of FibroScan and LiMAx in order to save biopsies. And what you can see here is that they came out with an algorithm now called the Essen algorithm, where you can see that patients that have a result of lower than 15 kilopascal in the FibroScan, they definitely don't have a cirrhosis, and if you are above 40 kilopascal, you definitely have a cirrhosis. And what is in between those borders is a little bit of a gray zone. So do they have a fibrosis? Which grade of fibrosis do they have, and so forth? And there you can clarify the situation by doing a LiMAx, where you then can clearly distinguish between fibrosis and cirrhosis. So, and there actually you don't need a biopsy in those patients. And by the way, the LiMAx also can help to detect these kind of liver disease in patients that are very obese, where you have difficulties, for example, to perform a FibroScan. So last but not least, a topic that is a hot topic all over the world, called NASH. And also here there was a study done at the Charité, and it was published in 2019 in patients to distinguish with the help of LiMAx between just, let's say, NAFLD and NASH. And also here a cutoff value was defined between NASH and no NASH, which is 288 mics per hour and kilogram, so with a relatively high sensitivity and specificity. So having said all this, and there are loads of other studies we can refer to, or you can refer to by looking into the literature list, there is definitely a place for LiMAx in liver diagnostic, improving actually liver diagnostic, and it is in conclusion an innovative, and it is a non-invasive, dynamic and semi-quantitative liver function test, which is really 100% reproducible. The examination can be carried out in daily real life medicine as well, of course, as in scientific studies. The LiMAx test represents a procedure with high potential benefits for diagnostic reliability, therapy decision making, course of therapy, and patient safety and satisfaction. Thank you very much for your attention.